want to talk about the nutrition aspect. In other words, like anything, eat fairly healthily will help our eyesight. And do I start with a carrot?
Carrot is a good start. Any of the antioxidant vitamins. One of the new devices that's available are the vitamins that are specifically for eyes that have high concentration of that, and some of the omega-3 oils. Found that they're very important to vision, to healthy vision. So for patients with dry macular degeneration, especially, there's not a lot of treatment we can do, but the antioxidant vitamins that are specifically for eyes are very helpful.
How about exercise in general? I mean, we know exercise increases circulation, and is that, I mean...
There's no definitive studies right now that I know of that are, linking eye health and exercise, but, general body health. Diabetes can be, a factor in eye problems, vision loss, also high blood pressure. So, those things, if we're not out there exercising, we're at higher risk for those type of things as well. So,
infections, are you diagnosing these? Are you seeing these frequently in
Oh yeah, most definitely. We can get an infection in the cornea or the front surface of the eye. We see that a lot in our contact lens patients who, aren't always compliant with their care or wear, or if they get poked or scratched in the eye, that type of thing. So, yeah, if that ever happens, it's a good idea to have that checked out, because if we get a scar or an infection in the eye, that can be pretty serious. And either if you're a contact lens wearer, you might have to be out of your contacts for a while. Sometimes you can't even go back into them after it. Or even if you're not a contact lens wearer, it's important to have that treated and checked out so that you don't have any vision loss from the scar that might result or anything like that. Yeah. Typically, the eye's pretty good. It's pretty protective. We don't get too many infections inside of the eye, but there definitely is a possibility if you had an injury that was deep enough, I guess.
We talked earlier a little bit on contacts. Are you still recommending the disposable contacts, or do you want?
Well, everything today in contacts is disposable. Okay. It's just a question of the frequency of disposability. Even the old contacts from years ago that you tried to keep for a year or two, they're disposable.
Yeah.
So today, what is actually the most popular worldwide is daily disposables. It's the healthiest alternative. You wear a lens for a day and you throw it out. So the next day you put on a completely clean lens. And a clean lens is always going to be the healthiest lens and give you the best vision. So a lens that's worn continually day after day after day, even though you're cleaning it every night, if it is a 2-week or a 1-month disposable, it still keeps some residual junk in the contact lens. Cuts down on the permeability so oxygen can't get through as well, and clouds up your vision a little. So the longer a lens is worn, some people will take a lens and wear it much longer than it's meant to be worn, and then wonder why their vision's a little blurry or why their eye's a little red and irritated. It's because they've overwore the lens. Yeah.
Remember when we used to boil, plug that heating and boil and fry the lens? Yep. Pink eye, is this, back to infections, does this still happen, and what is it?
Oh yeah, pink eye is real common in Michigan especially. We get it in the winter time a lot, more than other times. Back to school time, we've noticed a little surge as well, just kids are more in contact. Majority of the cases of pink eye are viral infections, although they can also be caused by bacterial infections, so it's real good to have that checked out. The viral type can be very contagious, so sometimes kids have to stay home from school for a time, but if it's not that type, then they might be fine to go back to school right away after that. So it's good to have it checked out so you know what type. Most of the time the school wants some kind of assurance that it's not the contagious type, so they don't have an outbreak in the classroom or whatnot.
Fall allergies, are we in the midst of this, Dr. Anderson?
We've been in the midst of allergies all year. I think Dr. Host will agree. We have seen more allergies in eyes. Patients will come in and say, boy, I'm having some redness, itching. Itching is a #1 sign that you have an allergy problem. And patients come in and they have that, and we look in their eye and we see some redness and some bumps called papilla follicles, and we tell them they have an eye allergy, and they say, no, I don't have any allergies. Well, they've got allergies with all the good pollen and ragweed and everything else we have in the air here. All the good natural stuff, we see tons and tons of allergies, and fortunately there's a lot of medications, prescription and over-the-counter medications that are helpful. So
you take those topically or?
Topically, yeah. Sometimes, I mean, taking an oral medication, if somebody has a history of allergies throughout their whole body, the oral medication will help. But then the topical one, specifically for the eye, will make the difference.
We have a question from you, caller. Hi, what's your question, please?
Hi, Shelley.
Hey.
I'd like to ask your guest, oddly enough, in Popular Mechanics this month, there was a story about, well, essentially, from what I took away from it, it's like a computer chip. And it's able to help people that have RP so that they can restore their vision, which sounded like extremely promising. Wondered if any of your gentlemen were aware of that, and if so, if there's that type of activity going on here in West Michigan. Thank you.
Yeah, thank you.
Sure. Retinitis, the caller was talking about RP, or retinitis pigmentosa. It's a genetic condition where the retina degenerates with time, meaning it doesn't work quite as well. Well, the retina in the eye is kind of like the film in a camera, all right? So it takes the picture that's coming in and converts it into an electrical signal and sends that onto the brain where we actually interpret what we see. If the film in the camera stops working, now we don't see. So yeah, there's definitely some things going on. I haven't read this particular article, but I have read some other things where they're implanting chips inside of the eye to have that electrical signal converted to an image and sent to the brain. Still very, very early in the stages in this, but that's certainly promising that there's research in that area for these folks, because retinitis pigmentosa eventually leads to permanent blindness. So if they can help out in that, that's definitely going to help folks.
It would give them some partial vision, some usable vision.
Yes.
It's not the same vision that we would normally experience with a completely healthy retina. So, but there's a lot of work being done. I don't know of anything done here right in Grand Rapids.
Great. Thanks for calling and letting us know that. We have another caller on the line. Hi, what's your question, please?
Yes, I'm calling from Zealand, and I have coma, and I'm currently using a prostaglandin, Travatan Z, in the evening, and then I'm using Alphacan T in the morning. And I'm wondering if Dr. Anderson likes prostaglandins or if he prefers a combination of drops.
Boy, it depends on the patient, depends on the pressure. If the prostaglandin doesn't give you low enough pressure, then you've got to add more to it. So it really comes back to the pressure that you can achieve with just the single, with the prostaglandin.
Some folks are on, even more than 2 medicines for glaucoma. We have, a couple other categories there as well. So, it sounds like this person might have had some eye pressure that's pretty high, and one drop didn't get the pressure low enough that their doctor wanted it to be, so they moved on to other things. There's also some surgeries out there that can help lower the pressure, but that's something that you should definitely explore with your doctor. That's kind of tough to say without examining and looking at the history of what the eye pressure was in this case.
And with just the prostaglandin, sometimes the pressure can, after using it for a while, can creep back up. We get it down low enough, and then it creeps back up and creeps back up, and you just have to add another drop to it.
Great. Another question from you, caller. What's your question? Thanks. Hi, caller. We're ready for your question, please. Once, twice, sold. Talk to me a little bit about eye injuries. We're in the sporting season. Getting hit with a ball straight in the eye socket. I trust the emergency procedures necessary in many cases.
Yeah, the most dangerous sports with the balls are the racket sports, because the ball
fits
is
into
actually
the eye,
pretty
doesn't
small.
it?
Yep,
Yeah.
it fits in the around the bony orbit, or I should say within the bony orbit, and it can damage the globe or the eyeball itself. So that's why racquetball courts require you to wear the protective goggles and things like that. It's also a good idea for any of the sports to wear some type of eye protection, because there's elbows and all kinds of things flying around, basketball and whatnot. So biggest thing there is prevention, of the injuries. As far as if you do get injured, yeah, get in to see your doctor right away. If it's during the week, you could probably get in to see your optometrist. On the weekends, probably the emergency room, and they'll refer you to the eye care person after that.
Yep.
That's it. If you do have a hit to the head,
Yeah.
to the eye, get in right away. Don't sit and wait around, because if you have some bleeding blood vessels and some various things, you might, if that happens on a Friday night, you want to get seen quickly.
Yes. We have a caller on the line. Caller, what's your question, please? Thank you.
I am 50 years old, and I've never had any eye problems. I don't wear glasses. Last time I had an eye exam, they told me just to wear the cheaters when I read. So my question is, how often do I need to have my eyes examined?
She's a young 50. What's the answer here, Dr. Anderson?
You should. We still recommend every 2 years. Your eyes will change, like our bodies change. We look in the mirror in 2 years; it's going to look a little different. So your actually refractive condition can change, and also the eye health, which is the most important thing, to check the eye health for glaucoma, for any of the other things that could show up that you might not realize that might not cause blurred vision right off the bat, but you might have some eye health conditions. So 2 years for a normal, healthy person. Somebody who's not healthy, who's diabetic, then you should have that yearly.
Is, eye health, is it linear with age? Am I guaranteed to have worse eyes when I'm 60 versus 50? Or does it
Well, the prevalence of all the different eye conditions that we look for definitely goes up, with age. So, does that mean we're going to have all of those things? No, but the risk is a little bit higher. So, we can screen for those, check for those, and hopefully catch them before they start to cause damage, so you can preserve that vision that you have throughout the rest of your life.
Yeah. She mentioned the cheater glasses. Do you recommend a cheater glass or a prescription, Dr.
Depends on the person's actual prescription. Sometimes today I recommended a pair of readers over the counter for somebody because they had the same prescription in each eye. They were just to the point where they were starting to need some close-up, and when they were doing some sewing tasks, they were in their late 40s, and so I said, boy, if you want to have a pair of +1s around because their eyes were the same prescription, that works fine. The drawback is if somebody's using some store-bought cheaters, the prescription in those is the same in each eye. Most of us have a little different prescription in each eye. So if you're doing a lot of close work, a lot of reading, a lot of computer work, and you're just self-diagnosing and trying them out in the store, you're not getting the best numbers or the best power for each eye. It can cause some fatigue. Isn't going to cause blindness, but if you're depending on that for your total eye exam, you're going to miss some stuff.
Yeah. What causes, Dr. Holzer, color blindness?
Color blindness, I would say 80–90% of the cases are genetic. There's, it's passed along. About 4% of all males are colorblind. Less than 1% of all females are. So, in some rare cases, there can be some color deficiencies whenever there's damage to the optic nerve. So, usually that's quite a distinct type of color blindness. So, it's easy for us to diagnose that during an exam if it's an acquired or later on in life color blindness. But most of the time, the standard color blindness that we think of is something somebody's born with, and it's a genetic trait.
Yeah. Just a couple minutes left. I always like to remind our viewers of the services of the Association for the Blind and Visually Impaired. I mean, if one is blind or significantly visually impaired, there are assistive devices out there. Dr. Anderson, can you tease us with this?
Sure. The ABVI is a great organization in town here. They have a low vision clinic. So when somebody starts having reduced vision that's not repairable, then we refer the patient there and they do a low vision exam and then test to see what kind of devices they may need to do their daily life, whether it's magnifiers or a bigger clock or bigger playing cards, or more specifically telescopes, closed circuit monitors that they can read their mail with and reading devices. So great opportunities. The advantage there is if somebody's losing their vision a little bit, has reduced vision, to get in there and get evaluated before you have a greater loss. It's harder to adapt to some of these devices when you've had a greater loss.
Yep, and just your final comments. Do what you need to do to see. We only have two eyes, right, BJ?
That's right. Yeah. That's right. Fortunately, we do have two. We've several patients who've had injuries to one and not the other, so they have a backup there. But the other thing with two-eyed vision is it's the most efficient way to see. We have better depth perception, easier eye tracking, focusing, all those type of things. So an eye exam is a good way to protect that.
Great. Thanks for all that education, gentlemen. Take care to you. And thanks to you for your questions. Good night.